All right. Firstly, thank you, Ziv, for that really great insights. I wonder why it was only 6 lanes and not 32 lanes plus 4 reversible lanes like the Gurgaon Delhi toll gate. But you guys aren't laughing. You guys don't find me funny? Okay, I'm going to have to tell better jokes then. Hey, ChatGPT, I need a really funny joke to tell this audience because I don't know. Okay, anyways, welcome to another exciting episode of Epicenter. That's right, where we feature business leaders and industry influencers who are shaping today's digital economy. Wow, look at this. 2 amazing people up here. Hi, Priya. Oh, you might need a microphone for that.
Hi, Ronen, and hi, everyone. Very happy to be here.
And Rohit.
Hi, Ronen. Thanks for having me here. Hi, everyone.
So, we got a pretty exciting session for you guys here, and I'm going to try and keep it lively and energetic, and I will keep my jokes to a minimum, as I said before. But firstly, I would like to introduce our distinguished guest here, Priya. Obviously, you are a former banker, and now you are championing India's biggest app store. And of course, Rohit, you're a 2X founder. You're basically changing a pharmacy into a healthcare business. Maybe we can start with you, Priya, and you can tell us how your unique journey has shaped or prepared you for the journey that you're on right now.
Sure. Thanks, Ronen. So banking and tech, to me, is actually not very different, though it seems very, very different worlds. The underlying basics remain the same. It's data, risk, innovation, and I think the underlying it all is finally customers. If your customers are happy, you understand them deeply, whether it's banking or tech or apps, I think it's all the same. So it's been an incredible journey, and change has been the only constant from banking to where I am now. So yeah, I think hopefully in this App Store journey, I can get to actually partner with most of the people in this room.
Wow, that's pretty cool. Banker to apps. Wow. Rohit, what about you? A 2X founder? I mean, you've done some amazing stuff. Tell us your story. Like, what brought you to where you are right now?
Well, I've been around. I started
You can
working.
see that?
Sure. I started working early in my teens and wrote code before APIs, made mobile apps before the iPhone, and advertised on Google AdWords as far back as in 2001. So being around, and change has been constant, but like Priya said, the fundamentals still remain same. And as we enter a wilder phase with this ongoing AI revolution, I think it's even more important to fall back on the basics and go back to the fundamentals about people buying from people, building trust in your brand, measuring accurately, and going to the market and learning from the market.
Yeah, I mean, I guess you must spend a lot of time in the market to know your customer, right? I mean, how critical is that maybe we all don't do enough of that, right? So let's kind of get into some of the bones of this discussion today, because I think both your organizations are actually challenging the status quo in tech with you, Priya, and healthcare. Maybe Priya, can you share one bold move that your company has taken recently that will help impact, what you're building?
Sure. So I think at PhonePe Group, one of our visions is actually democratizing digital access to every Indian. I think we started with payments at PhonePe, and we've done that using UPI to transform how India pays today. At Indus, I think I think that's what we want to do. We want to transform how app commerce works in India. It's day zero for us, but looking to build out a challenger horizontal app store, which can enable the Indian ecosystem.
That's pretty cool, and it sounds like a pretty big challenge that you guys have ahead of you. I mean, you're basically taking
Not easy,
on
but baby steps.
Google and that Apple thing, right? And how about you, Rohit? What what is it that you guys are doing and that the company is doing that you're going to create impact in your business?
Sure. So for context, we are an e-pharmacy, and we also have a bunch of stores, retail stores, about 150 in Bombay, some 50 in Pune, and 100 plus in rural West Bengal. And the bold thing, a new bold thing that we've launched recently is we ventured into quick commerce, except that we ship from our retail stores and not from dark stores. It's still early days. We've just launched a few weeks ago in some pin codes in Bombay, and so hard to tell what the overall impact is. But early customer love is positive. Business metrics are up low double digits. So yeah, that's what we are on to.
But clearly, the impact that you're making is well beyond the business that you're doing. You're actually putting drugs. Not drugs, but drugs like medicine.
We are in Goa, be careful.
When in Goa, but you're actually helping people to basically get access to medicines that they wouldn't be able to access.
That's correct. So about 60% of the strips that we sell are of our own private label. So I sell Crocin, which is made by GSK, but I also sell my own paracetamol, which is made by our own company in the same factory that that other one is made in. And we're substantially cheaper. So yeah, the impact is primarily for those who otherwise can't afford the cost of chronic medication taken every month. About 40% of our customers are those who wouldn't be able to afford allopathic medicines at all if we weren't there for them, we or our competitors, our category wasn't there for them. So yeah, that's a big impact, and the other 60% just like to save money and invest in their child's future or whatever.
How much cheaper?
Well, about 70-80% of the medicines we sell are for chronic medications like diabetes and BP and so on. It's very easy to rack up a monthly bill of 2,500, 3,000 rupees in some of these chronic conditions. And if you buy the same medicines from us, it costs about 500, 600 thereabouts. So about 70% cheaper than what your doctor normally prescribes to you.
Priya, does India really need another app store?
I've been tracking this session from the beginning, and all I've heard is India. Sanjay said India can't be painted in one color. Siddharth said if you go to UP versus another state, it's local. You have to build for the local audience. When we're saying that on one side, how can India not need an app store? We are here, all of us are using a global product, which is addressing or rather serving our needs. I don't think there has been an app store built which is addressing our needs. And I think that's what we want to change. That's the consumer end of it. All of us here as developers and partners, are you happy with just selling all your products from one store or directly? It's always better to have more than one store to sell. So I think there is an opportunity and gaps at both ends, and we definitely need one. And I hope all of you by the end of it say it's a resounding yes.
So let's talk a little bit about the strategy, right? Because, here we have a room full of developers and you want them to basically publish their apps in your app store. How do you plan to do that? Like how are you going to drive developer adoption, and level the playing field for these guys? Because surely they must feel like they're getting screwed by Google and Apple every day.
So I think developer is key. At the end of the day, we are a two-sided platform which connects a developer and the consumer. So I think for us, first and foremost is being a developer-friendly policies, being transparent, actually providing access to data as much as we can. One other data point, and I think AppsFlyer would know this better than anybody else, is if you look at the app ecosystem in India, unless you're in the top, 10,000, maybe 25,000 apps, when you have significant downloads, the rest of the apps actually don't even have a chance. How do we actually build this ecosystem? How do we lower entry barriers? Does everybody need to have bucket loads of money to actually create impact? So I think that's where the product kicks in, that's where policies kick in. Also, the commissions, which has been discussed globally now, I don't want to comment additionally, but does it need to be, is there that much value to only platform? How do we disrupt that and how do we actually pass value across the ecosystem? I think that's where we think we will make a difference. Also, coming from a payments and e-commerce edge as a PhonePe group, hopefully that is another disruption we can bring in, actually enable the ecosystem and give back value.
That sounds pretty cool. I think it's a pretty good proposition for a developer, right? To gain access and I think when we talk about access, Rohit, I mean part of what you guys are doing is actually making pharmaceuticals accessible to people that really can't afford that. Now, how do you communicate that through your marketing strategy? Like, how is ZENO helping to reshape the access to these type of drugs, and what is it that you guys are doing to build that trust? Because I can imagine that trust is probably one of the most critical elements of actually getting someone to buy medicines from you.
Yeah, medicines are typically the last things you kind of experiment with, mess with. And our challenges are different from a typical e-pharmacy. Let's say if your Amazon pharmacy is selling Crocin, the trust in Crocin is built over the years for the customer already. The trust is inherited from the end product. Amazon pharmacy just has to earn your trust for shipping it to you reliably at the right time, at the right price, and so on. But we are a maker of medicines as well. So I have a double trust problem to solve, that you've got to buy from me and you've got to buy my private label products from me. Now, and like I said, people don't experiment with medicines in general. So the combination of social proof, a combination of expert proof, which is your doctors, social proof is, people like you around you are using our medicines and are benefiting from it. A combination of these two pegs in our communications and in our product experience have helped us, earn the trust, at least to try our medicines and then see if the impact is same.
Yeah, I was reading on actually the website that trust is a core pillar of ZENO Health, which resonates very well with me at AppsFlyer, because that's trust and data security and privacy are also core to us. I want to talk about the elephant in the room, and that's not what's going on with the air condition. I want to talk about regulation and measurement. Obviously, India is about to embark on a pretty big regulation and shift with new laws coming into effect. I understand within the next few months how severe or not that they're going to be. But these regulatory challenges and how are you guys addressing them when we talk about also the evolution of measurement methods, which are critical for both like tech platforms and like you guys and healthcare? Like, how are you guys addressing that? Priya, for example, if you could tweak one regulation in the India app ecosystem, what would that be and why?
That's an easy one. I think level playing field, fair distribution practices. I think it's also every market is actually talking about it. And in India also we're talking about it, and hopefully we'll get there.
But when we talk about regulation and basically the access, like consumers still need to give consent and give permission. Why you guys? Like, what are you going to do different than the rest?
I think this is something we will solve through product. The consumer needs to want to use the product. I think that's, at the end of the day, the only way to make a viable business. So as long as the consumer, and one, we are transparent with them as well at the outset. You can't tell them something and then, take away some of the data and pass it on to something else. I think transparency is key. Consumer is also on that learning curve of what data should I give and what data should I not give. So as long as you're transparent, and you should be able to gain consumer trust with a great product. And it's very important. Consent is important, and telling them upfront is super important.
It sounds like your approach is actually like, let's put it on the table in the beginning.
Yeah.
Right?
Absolutely.
Let's be transparent about what we are going to do.
Yeah.
And then you as the consumer can decide, right?
Yeah.
How you want to go forward, right?
Absolutely. I think that's the only way forward.
And Rohit, with privacy like shifts, like how are these impacting the way that you are able to run, your marketing and measurement, and are there limitations to what you can do? Just talk to us a little bit about that.
Well, I've been having weight management issues, and when you said let's address the elephant in the room, instinctively stuck my stomach in, just filling in for your missing jokes. Yeah.
I see some smiles actually.
Sure.
You're getting better traction than me, that's for sure.
Right. Regulation. So we get affected by regulations at two levels. There is the regulations of the state, the government, and the regulations of the quasi-governments, the large ad networks. Outside of the sin categories, the intoxication, gambling, and so on categories, our category is probably the most affected by various regulations of Meta and Google and others. And so, for example, a few weeks ago, Meta blocked the entire healthcare category in India from optimizing our performance campaigns on the purchase event, which means we had no option but to move slightly mid-funnel, like add to cart search and other things. But that's crazy. That just shot our metrics big time. UACE is not allowed in our category, which means I have to, shift my retargeting efforts to other platforms. It's been crazy. I could go into the details, but for example, we can't use custom audiences with custom events in Meta for targeting. So it's tough. It's a very hostile environment for good reason. I understand why these regulations are required. Probably I would impose the same if I were in their place, but it's been challenging, and I've been in the job only 3 months, discovering some of these, challenges. I come from a world where there were no such restrictions, and it's been a learning curve. But what we are doing is falling back to good old practices. So building our own zero-party and first-party data. Zero-party is self-reported by customers, like when they type their date of birth, and first-party is when we infer from their behavior or their technographics and so on. So building our own data pools and understanding our audiences better so that we can rely on interests and behavior signals instead of lazily just uploading customer lists and telling Meta, get me more lookalike audiences and so on. So I don't know if that answered your question, but it's a very hostile regulatory environment for our category, and we've had to go back to basics to compete.
So I hear your pain, and hopefully it's one of which we will try to solve. So I think one of the questions we have been grappling with is, why should global policies or global diktats actually dictate what happens in India? Are there different ways? And we all understand trust and safety is paramount. Are there ways to separate the good apples from the bad? How do we enable that, by partnering with the local groves, the government, and how do we enable that? And hopefully we'll get there.
I haven't seen good apple. I've only seen.
Yeah.
So it sounds like there actually might be a use case where you can solve some of the challenges that ZENO Health is facing. So with the App Store, you also provide the ability to reach consumers? And that's through the PhonePe network, or?
I think it'll be a journey. We're at day 0, like we said, of our journey. It'll be multiple ways. It's partnerships with OEMs, partnerships with ad networks like yourselves, the consumers themselves coming on the App Store. I think it's multiple prongs, but we'll get there. I think hopefully very soon, one of the inertias which is holding pretty much every one of you in the room, which is where are these consumers you're talking about? Hopefully we'll solve that, and we'll get there soon. Yeah.
So both of you talked about data. You both talked about first-party data and zero-party data. Are there lessons that you guys have learned from as an organization on how you would share data with one another, or how you share data internally, or how you would share externally? Is there use cases or things that you guys have learned that you can share?
So I'll go first. I think being part of PhonePe group, we are sitting on immense amount of transaction and payment data of consumers, and with like 5 regulators regulating us, it's very important that we deal with it in the right fashion. So there we have made sure that I think we take consent on every single thing we do, whether it is sharing with our internal entities or, external at this point, we do not share. And considering it's very sensitive data from a consumer perspective, consent is the only way. And we want to tell people, like I said, back to the transparency point, we will use the data to make it more efficient for the consumer and hopefully give value to the consumer, not to just enable one part of the ecosystem. I think that's where it breaks. If you actually give value to both, people are okay. I do share a lot of data when I need something.
Rohit, you deal with super sensitive first-party and zero-party data, right? What are some of the learnings that you guys have had?
Well, it's only been 3 months here, so not many learnings to share from here, but I'll share something which is counterintuitive from my previous stint, which was with JioCinema. Just for some perspective, we went from 0 records in March 23 to 400 million records in June 24. I'm talking about customer records, first party and zero party data across the 2 IPLs. Some of you might have noticed some questions when you watch an IPL match on your JioCinema app. If you felt crept out by that, it was me running that program among the other things I did there. The counterintuitive lesson is just ask. You will be surprised by how much Indian consumers are willing to part with their data, how easily. Like, we are a country where we give out our phone numbers to random security guards and restaurants, and we give our Aadhaar card copies at the drop of a hat everywhere. And I'm afraid the top 0.5% of India, most of us are in that segment, project our own privacy consciousness onto the 50 crore mobile users on India. But if you just break that and shamelessly just ask simple questions with some context as to what will you do with that information, you have no idea how much Indian consumers are willing to part with that data. So just ask I know it sounds shallow and cynical, but it is true. Talk to me if you want to know more.
Actually, I wouldn't say it sounds shallow. I would say maybe the most powerful thing that you can do is to ask.
And I cannot overstate the value of that 39-40 crore data set in our acquisition, retention, ads monetization, experience personalization, and all we did was just ask.
It reminds me of asking, and in sports, they say that I miss 100% of the shots that I don't take, right? And so if you're not asking, actually you have a 0% chance of getting any permission whatsoever. And I think this is something that I've picked up from both of you, is that, transparency, making sure that you're asking the right questions, being upfront with what it is that you're offering the customer. And I think that, all too often we forget that we're dealing with people at the end of the line, right? The people who are downloading the apps, the people who are buying the medicine. Even for us, when we look at solutions that we provide, for example, like OneLinks, and if these don't provide a good experience, we've not done our job, right? So, I really think this has been quite interesting. And as we kind of round this session out, I wanted to do a quick fire round. Anyone,
Sounds scary.
are you guys down for it?
Coffee with Ronen.
Well, you see, I watched a few episodes of Coffee with Karan, and I really like his version of quickfire rounds, and especially like with this cricketer Hardik Pandya. So I thought, okay, maybe Rohit, I'll start with you.
We're not answering without the hamper.
Yeah, we
though.
need a hamper and not something that gets us in trouble and hampers our career progress, but a hamper.
So Rohit, let's start with you. What's your favorite cricket team or your favorite cricket player?
Mumbai Indians and Sachin Tendulkar.
Okay, that's pretty cool. So we're safe already on the first question, huh? Priya, is there an app that you can't live without?
At this point, it's Instagram. I'm one of those addicts who's on Instagram all day long. I keep deleting it once, I think 1 week in a quarter, but I'm addicted.
How much time do you spend on Instagram
I
every
don't have a
day?
Show us your
Parent
phone now. Show us your screen time.
Yeah, I don't have a parent tracking my screen time, thankfully.
So, Priya, I want to stick with you. Imagine you could get a first-class plane ticket to anywhere in the world. Where would you go and why?
I would go to Hawaii and have a
Hawaii?
good time. Yeah.
Nice. And we're here in Goa, and she wants to go to Hawaii. Come on, Goa, we got to pick it up. Rohit, if you could drive any car for a week, what would it be?
I hate driving, so I wouldn't. I'm happy on my back seat.
What?
No car would make me happy.
No car.
Maybe an autonomous car.
An autonomous car. Have you been to the US and been in one of these Waymos?
Not yet.
That's scary. I wouldn't be able to close my eyes.
Yeah? Okay. So, Rohit, do you have a favorite AI tool?
Yeah, I like Perplexity.
Why?
I like,
Just because it's made by an Indian guy?
No, not really. Because it allows me to change models and ask the same. Now, for example, I'm enjoying R1 now, DeepSeek R1, and I can. Some models are good at certain type of questions. So because I can switch right there and ask the question again, it's pretty handy.
Priya, talking about screen time, how much time do you give your kids on their mobile phone every day?
Thankfully, my kids are a bit young, so haven't gotten there too much. Only my older one, which I try to restrict it to about an hour, but I don't think I'm going to have control very soon.
Yeah, good luck with that. How about you, Rohit?
Well, my daughter's 18, so...
So she restricts you?
Yeah, that, that time's gone. My son's still 13. He has, a very good product called Family Link on his phone. And yes, he has a few hours on the mobile, a couple of hours on his Windows machine. Over the weekend more, during vacations more, but otherwise 3-4 hours a day.
Well, I think that completes around maybe 30-something minutes of screen time on my phone right now. So call it a wrap, Priya and Rohit. Thank you so much for joining us at Mama Goa and Epicenter Live here. Let's hear it for them. Woo!
Thank you.
Thank you.